babies go home safely. That has been the advancement that we grab, through which we also are able to treat a lot many more children in the place where they are born and without having to really transport them. The care standards and the care levels available in these remote areas are relatively, obviously, much lower than what could probably be available in a larger city or in a place like Bangalore. So to go and set up a very intensive program, probably from an infrastructure wise, will be reasonably possible. But what's very, very important here is the clinical expertise. Neonatal intensive care program in India is probably about 15 to 20 years old in terms of its advancements, right? Earlier than that, it was available as a program, but the kind of treatments, the treatment protocols, the expertise, along with the improvement in the technology, all of it had happened in the last 15, 20 years. And most importantly, a lot many more clinicians, senior clinicians
are born in India too early. So that is one of the major issues, because prematurity is on the rise. Why is it on the rise? It is basically environmental factors, low socio-economic factors, mother's health in general. So when you look at all these things, the premature births are increasing in India, and out of which, if a baby is born at 20...
A digital platform. Motherhood nurses coordinate with the bedside team to gather data and work together in getting it updated. All aspects of clinical workflow, including hourly vitals, medication charts, notes, and investigations, get incorporated on the platform. The NICU Live digital platform is also available as a mobile application, and one can even conveniently access all data on your phone with the touch of a finger. Data collected through the platform helps the motherhood team to provide timely and accurate guidance. NICU Live's digital platform, any NICU becomes completely digitized. Constant and instant communication between the partner, NICU, and Motherhood Care Center is ensured through a virtual call that helps in providing timely intervention, coordination, and assistance to the bedside team. The 24/7 live virtual call ensures that all stakeholders...
2 out of the 6 was more into a congenital defects, where the baby was born without a diaphragm, where like baby had a congenital heart defect and they did not know to diagnose it, and it was already too late. So these are the kind of 6 things we were not able to make a change just because there was a delay in the referral to the centers that were taking care.
When we look at the larger data aspects, prematurity stands as the #1, followed by infection in India, and third, where the babies did not cry after birth. So this is the general...
ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೆ. ನನ್ನ ಹೆಸರು ವಿಜಯರತ್ನ. I am the CEO of Motherhood Hospitals. Today we are gathered here to discuss a very important advancement in the area of neonatal intensive care given to the newborns. NICU Live, as we call it, is a new concept which uses technology to treat children who are far in the remote areas. This is a concept that we have been working on for almost close to a year now. We have now about 30 NICU beds being managed across different parts of this country and have treated more than 300 children through this technology. And the results are brilliant, and we have been able to save and do a very, very good treatment and discharge these children much earlier through the technology and the treatment protocols that have been laid down exclusively for treating these children through the remote concept that we have. We are extremely happy with the outcome, and we are looking forward to taking this entire technology to a much wider and larger part of this country and make a difference to the treatment of newborns who really, really need the care and the advanced care that currently available only in probably the metros and A cities, A-class cities of this country. But I think this technology will help us to take a similar level and standard of care to very remote areas and help children do well.
So what are the remote locations?
Currently, we have the NICU Life program running in places like Hindupur, Anandpur, in Bihar, and even in a place in Punjab called Hisar. And we are looking at expanding this to many, many more remote regions of this country.
I hope that the team of doctors are going to recommend the type of treatment, I believe. Of course, this is the decision is taken by the team, or I mean, definitely, it's a technology that is helping, and you are going to take the
700, 800 gram babies, okay, who's born less than 6 months of gestation. So, antavadralli adun kuda hidkotheve ನಾವು, because that can cause damage to the baby even if the baby survives. So, ee ರೀತಿಯಾಗಿ then changes in the heart rate is one of the most impactful things where easy early detection of the conditions you can do. So, adana kuda ಮಾಡ್ಕೊಂಡು the technology is helping us. Over a period of time, what will happen? AI, which is artificial intelligence, will merge in. ಕೊನೆಗೆ ಏನು ಮಾಡುತ್ತದೋ, ಸರ್ ಇದು ಲಾಸ್ಟ್ 15 to 20 ಮಿನಿಟ್ಸಲ್ಲಿ ಬೇಬಿ ಕಂಡೀಷನ್ ಚೇಂಜ್ ಆಗ್ತಾ ಇದೆ, ನೋಡ್ಕೊಳ್ಳಿ ಅನ್ನೋದೊಂದು ನಮಗೆ ಇನ್ಫಾರ್ಮೇಷನ್ ಕೊಡುತ್ತೆ, ಸಿಗ್ನಲ್ ಕೊಡುತ್ತೆ. ಸೊ ದ್ಯಾಟ್ ಮೇಕ್ಸ್ ಇಟ್ ಇಟ್ಸ್ ಲೈಕ್ ಎ ರೆಡ್ ಫ್ಲಾಗ್. ಓಕೆ, ಸೊ ದ್ಯಾಟ್ ಮೇಕ್ಸ್ ಥಿಂಗ್ಸ್ ಮಚ್ ಈಸಿಯರ್. ಸೊ ಇಲ್ಲಿ ಕೂತ್ಕೊಂಡಿರೋರು ಎಕ್ಸ್ಪರ್ಟ್ಸ್, ಬಟ್ ಸ್ಟಿಲ್ ಆ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ಗೂ ಒಂದು ಎಕ್ಸ್ಪರ್ಟ್ ಮೇಲೆ ಕೂತ್ಕೊಂಡು the technology is going to help us out. So this is the whole project called NICU Life.
Okay, sir. Thank you.
Thank you.